Good morning, everybody. A very warm welcome to you all to our webinar on managing lymphedema. As Victoria said, my name is Catherine and I'm a support services officer here at Overcome. I work alongside Anna and Alice. The support team are here Monday to Friday, 10 a.m. to 5 p.m. to provide information and support to anybody affected by ovarian cancer. You can get in touch with us via our support line, send us an email, message us via instant chat on our website, through our online forum, or you can schedule a time for an individual video call via Zoom or Skype if that works better for you. If any questions come to mind after the webinar today, or if you wanted to talk anything through, please do get in touch with us. We're here to talk through questions, provide information resources, or just have a friendly chat about anything that's on your mind. All of our contact details are available on our website, and I'll put them in the chat box as well during the talk today. So how the session is going to run is that we're going to have the presentation first of all, which will be around 45 minutes. And as Victoria said, we'll have time at the end for questions. So I'm absolutely delighted to welcome Karen Friett from the Lymphoedema Support Network and Eszter Valach, who's a lymphedema specialist practitioner physiotherapist. Thank you.
Good morning, everyone. My name's Karen. Just to let you know a bit about me, I'm a nurse by background, but I currently work as the Chief Executive of the Lymphoedema Support Network. We are the charity in the UK that provides information and support for those people who live with lymphedema. So how it's going to work, I'm going to give you a little bit of a presentation which will answer some of your questions, or the questions we're most commonly asked. And then there'll be time at the end for you to ask questions, which the vast majority of those I'm expecting Eszter will answer in her capacity as a clinical specialist. If by any chance you don't have time to have your question answered today, or you think of something afterwards, then our colleagues at Overcome have both of our contact details, and they'll be able to put you in touch with us so that we can get you an answer to those questions afterwards. So what we're going to answer today, hopefully, is what the lymphatic system is and why it's important. And the reason we do that is just so that to empower you to make good choices based on good information. What lymphedema is and why particularly you might be in a situation where you're at risk of developing it, how you would recognize if you were developing the condition and what you can do to reduce the risk of it happening, what you should do if you worry or are concerned or notice that you have some of the symptoms we've been talking about. And then, as I say, at the end, there'll be plenty of time for you to answer some questions. So in our bodies, we have three transport systems, and most people, if you ask them, will certainly come up with, if you're at a pub quiz, they'll say, oh yeah, veins and arteries, that's what takes all the goodies to the places it needs to go. And very few people will mention the lymphatic system, and it's equally as important as both the veins and the arteries, and we'll come on hopefully to discover why. It's primarily, people think about the lymphatic system as being our waste disposal system, putting it in simple terms, but it's part of our immune system. So it removes bacteria, proteins, anything we don't need, and excess fluid from our tissues. So around the skin, the bone, the fat, the muscles, and that's inside our bodies as well as on the surface of our bodies. And the reason that it's important in your journey with your cancer is because it also has a role in trying to stop the spread of mutant cells, so cells that are not as they should be, which cancer cells would fit into that category. So many of you would have had either sentinel node biopsies or lymph node removal in order to see if there's any malignant cells in those lymph nodes. So it's really very important. So people sometimes say to us, well, why did they take them out and then leave me with lymphedema? Well, they took it out to be able to check what kind of treatment you needed to hopefully put your cancer at the back of your mind. So that's why it features in the cancer journey. But it also has a special fluid called lymph, which make sure that all the good things and the stuff that the body needs goes back into the circulatory system, into the large veins. So either it can be removed from the body via your urine when you pee, or it can be put back into and recycled to be used again. So we have very, you saw in the picture, lots and lots of a network, if you like, of lymphatic vessels, and they start very close to the surface of your skin. I'm quite a veiny person, so if I make a fist and look on the back of my hand, I can see the blue veins under my skin slightly. And if I just gently stroke those where one of those veins is, it kind of disappears. And between where that vein is and where my skin is are the first of our lymphatic vessels. So they're that close to the surface. And they are microscopic. You can't see them very easily. And also what happens is that those are the vessels that fill with this fluid, which is called lymph. It's quite often colorless or a little bit milky looking, and that's called your lymph fluid. This fluid is transported in one direction by increasingly larger and deeper vessels. So I always imagine the very superficial ones to be a little bit like the balloons that balloon modelers use. And usually if you're not moving, if they're just resting, they're not particularly engaged. They're just like the floppy balloons. But when they're filled with the lymph fluid, once they get to a certain point of filling, they automatically squeeze and they empty that fluid into the deeper lymphatics. Once those are filled, they squeeze and empty again into the still deeper vessels. And that lymph fluid at some point in its journey will pass through lymph nodes to be filtered and cleaned. And then it's recycled, and it's recycled into the blood at a point just behind your collarbones. And that maintains the fluid balance in your body. This is what a lymph node looks like. Obviously, it's microscopic. It kind of looks a little bit like a baby kidney. And there are big clusters of these around your body. They're like biological filter stations, and the biggest stations are underneath each armpit, in each groin area, each side of your pubic hair where your thigh joins your body. And those are the ones that are usually harvested when they're looking for, in the case of ovarian cancers or any gynae cancers. But you also have them in your neck, you have them behind your knees, you have them deep inside your body behind your tummy button. And they also produce lymphocytes to fight infections. And they regulate the amount of protein that's in our body, which is important. So what then is lymphedema? I've told you what lymph is. I've told you what the lymphatic system is. So what's lymphedema? Well, when something goes wrong with that system, that fluid ends up either staying where it shouldn't be or not being able to get to where it should be. And that leads to it accumulating in an area. So usually in the case of people who've been on a cancer journey with gynecological cancers, that tends to be in the lower limbs, or sometimes in the area where your pubic hair is, sometimes in the labia, sometimes in the buttocks. So if fluid collects where it shouldn't be, then that's what we call lymphedema. So it's a swelling where it shouldn't be, that's produced by lymph. So it can happen when, in the case of cancer treatment, when the lymphatic system, when those networks have been damaged because they've had to be irradiated or they've had some removed. But it can also happen in a different kind of lymphedema. Sometimes people are born with a lymphatic system that is not adequate. And there are other kinds of secondary lymphedema if you have heart failure or if you're not able to move as you should be or you have trauma in the area. So there's lots of different reasons people get lymphedema, but the bottom line is the condition is the same condition. So the question everybody always asks, and it's quite reasonable to ask it, is, will I develop lymphedema on my cancer journey? Is it likely that I am going to end up with lymphedema? And the harsh truth is, I have to put my hand on my heart and say, we've got no idea. And that's a very, very difficult thing to have to hear, because obviously we want to reduce the risks of getting it. But the fact is, we don't know yet why some people develop lymphedema and others do not develop lymphedema. We'll have some situations in women with breast cancer, for instance, who've had every single lymph node removed from under their armpit and they never develop lymphedema. We'll have other people who've had one lymph node removed and they develop lymphedema. Research is currently being done into the reasons why some people get it and some people don't. But there are things which we do already know, which can help you reduce your risk. But if you take nothing else from this talk today, please take, if you develop lymphedema, it is not your fault. You have not done anything wrong. And it is really, really important that the shadow of lymphedema doesn't stop you living your life post your cancer diagnosis. Okay, so we're going to talk about things which might help you reduce the risk. But if it happens, it happens. If it happens, you'll get support to deal with it. We could talk about statistics, but they don't really tell you anything. They're not of any real benefit because, you know, I can tell you that ovarian cancer, people with ovarian cancer, up to 38% of people will get lymphedema, but that depends on what stage their cancer was when it was caught, what treatment they've had, and many, many other factors. So for some, it seems lymphedema is inevitable, but there are things that you can reasonably do to reduce the risk, okay? And what we're going to talk about, things that you can reasonably do. The other things to bear in mind, that theoretically there's a lifelong risk that you might develop lymphedema, but the reality is that the vast majority of people will develop the condition within 2 years of completing their treatment. Keeping or getting your weight into a normal range for your height, we know significantly reduces the risk of developing lymphedema, and it also appears to be of benefit in stopping your cancer recurring. And the other thing that's really important is to avoid an infection in the at-risk area. And I'll talk to you about which areas of your body are at risk in just a moment. So this, I don't quite know why she's got that weird hairstyle, but there we go. This is supposed to be a normal human being. And the at-risk area really rather depends on what you've had done to the lymphatics. Okay, so if you imagine your lymphatic system, it very much works in quarters. So if you were to draw a line from the top of your head right through the middle of your body down to where your feet are, so in between each breast, down past your belly button, and split your body half that way, and then split your body in half across your waist, your body will be divided into 4 parts. Now, if you've had treatment for ovarian cancer, it's usually 2 quarters that are affected because they've usually looked at both sides of your pubic hair. So that means that the whole of your bottom half is an at-risk of area, okay? That includes your feet, your legs, your buttocks, okay? So in the case of most people who've had gynecological cancers, it's your at-risk area is from the waist down. And what we're trying to avoid is local infections that mess with the lymphatic system from the waist down. So your lymphatics are involved in infection control. Okay, in that area of your body where you've had the lymphatic system messed with, you are more at risk of developing local infections because the surveillance, your body's ability to watch out for infections is reduced. And the one we particularly worry about is an infection called cellulitis. Anything that ends itis means there's an inflammation in that area. So appendicitis means your appendix is inflamed. Tonsillitis means your tonsils are inflamed. And cellulitis, it won't be hard for you to guess, means your skin cells are inflamed. It tends to be an infection that happens from the outside in. So if your skin barrier is broken, might be a bite, might be a cut, might be a graze or a blister, then that can allow bacteria to get in. If you had a healthy lymphatic system, that would clear up those bacteria and get rid of it for you. In the case of some people who are at risk of lymphedema, it doesn't do the job very well. What it doesn't mean is that you're at higher risk of systemic infections. So because you've had lymph nodes removed, it doesn't mean you're more likely to get flu or COVID or shingles or any of the other systemic infections. And it doesn't mean that you shouldn't have your vaccinations for those if you are offered them. So what you can do, this is one of the ways we can reduce the risk, because we know if you get cellulitis, you're more likely to get lymphedema in the future. Keep your skin well moisturized and check it regularly for injury. Be careful of high risk events. We don't say don't do high risk events. We say take care. Okay. So if you want to wear shoes for a special occasion, wear the shoes if they fit you, but just make sure you break them in so that you're not likely to get a blister. Use insect repellent if you're going somewhere where you know there's going to be bugs. Use sun cream. I said here gardening gloves. I apologize for that. There's no reason for you to wear gardening gloves unless you garden with your feet. That's obviously jumped over from a breast cancer talk. Electric razors rather than safety razors. Some people get on quite well with the exfoliating creams and the creams which get rid of hair. Best to do a little skin test to make sure it doesn't affect your skin before you use those. Follow a balanced diet, keep your weight within normal limits, drink plenty of water, and use your limb normally. Try and take gentle, regular exercise. Swimming is great. Just been talking to a woman this morning who does wild water swimming. My goodness, that's a brave thing to do. So the don'ts. This is very individual and should be approached with common sense. So this is your journey. These are your decisions. But if possible, don't allow that skin barrier to be broken. So avoid injections if possible. Okay, if you do have to have an injection, supposing you have to have an injection, supposing you get a kind of anemia and you have to have a B12 injection or something like that, and you need that injection to keep you well, and the best place for you to have that injection is in your thigh or your buttock, then obviously you need to have that injection. So you take the lead, you be the person who's in control of that. So take with you a little sterile gauze. You can buy it from Boots, and take with you a little sterile plaster from a packet of plasters, one that's still in its package. Okay, because normally, as you and I know, you go and have a blood test, you go and have an injection, and they'll probably cover it up with a little bit of cotton wool that's been on their table for we don't know how long. So you don't want to be exposed to that. So just explain, when you've had the injection, please could you just use this bit of sterile gauze to put some pressure on, and then when you cover it up, please could you use this plaster. Keep the plaster on for 24 hours, your skin will be healed, jobs are good. Don't go crazy when you're starting new activities. Start slowly and build up and listen to your body. Okay, so if you decide you want to take up any sport, there's no reason you shouldn't try it. Yoga, Pilates, swimming, jogging. We have people who do all kinds of things. We have a lady who's a professional bodybuilder with lymphedema. We have another lady who's a fantastic winter sports person. We have other people who are dancers. It needn't hold you back from doing anything. But when you start something new, take it really, really slowly. And when I say listen to your body, the kind of things you're watching out for is, do your legs feel heavier than they normally would? Does it take you longer to recover than you would expect it to do? Are your legs very red and stay red for a while? Are your shoes a bit tighter? Are your trainers a bit tighter? If those kind of things happen, then maybe that's not the right sport for you, and just pull it back a bit and try something different. Please don't get sucked into buying gadgets, gizmos, and junk from Facebook. If any of these worked, we would be telling you about them. Okay, so the latest one is grounding sheets. There's absolutely no research to support that grounding sheets will help you, will help your lymphatic system. They'll quote research at you, but when you look at it, actually it's one person and a dog they tried it out on. So, please be really, really careful. If you want to try any of those things, then please do. But go into them not expecting much, and please don't spend all too much money on them. Another one is vibration plates. It's actually just as cheap, just as good for you, and a lot cheaper to get up and go for a walk. If you're not able to walk, then maybe a vibration plate would help. But please don't get sucked into things, okay? And don't let fear of lymphedema stop you from living your best possible cancer life. So I've already told you what sort of things to look out for. heaviness, stiffness, tightness. And remember, it's also your genitals and pubic area. So you may notice some swelling, and the swelling gets worse as the day goes on. It maybe doesn't go down overnight, those kind of things. Okay, so if you do notice any of those symptoms, then if you're still in touch with your cancer team, then they should be your first stop. The reason they're your first stop is because anything new when you've had a cancer journey needs to be looked at. That's common sense. And that's what they're there for. If they agree with you that what they're looking at is possibly lymphedema, then they will know where their local care centre is and they'll be able to refer you on. If you're no longer under the care of your cancer team, so if this happens in your cancer journey in 5 years' time, then your GP is the person to speak to about it. And many GPs are not experts on lymphedema, so you might have to be the one to use the word and say, 4 years ago, I listened to a talk about lymphedema. Now I've got this swelling. Could it be lymphedema? And then your GP will take it from there. If it does happen, please don't panic. Okay, many people live really, really, really normal lives with lymphedema. Please don't look it up on the internet, or if you do, go to a site you can trust. So go to our site, go to the Overcome site, go to Cancer Research, go somewhere where you know the people know what they're talking about, because there are some truly horrible pictures on the internet labeled lymphedema, which are particularly connected with a tropical disease called oh gosh, I can't say it. Eszter will say it later. I've got new teeth. Lymphatic filariasis, there we go, which is caused by a nasty little fly in the tropics, and people's legs end up looking like huge elephants' legs. That won't be your journey with lymphedema. Your journey will be very different from that. So don't be panicking yourself by looking at those pictures. The 5 cornerstones of treatment are compression, skincare, movement, weight management, and a special kind of massage called simple manual lymphatic drainage or simple lymphatic drainage. Compression is the stalwart, really, and these are medical grade, in the case of lower limb, medical grade stockings or socks or cycling shorts, depending on where your fluid is. And these basically encourage the fluid to move to a part of the body that might be able to deal with it. So they tend to be tighter at the feet end, and they kind of, if you like, encourage the fluid upwards. So that's their first job. The second job is they act as a kind of minimizer. So they stop the fluid having free flow to grow as long as it likes, because there's a limit because of the compression. They also, as you're walking, as you're moving, give you a micro massage, which helps stimulate those superficial lymphatics in your skin, and they provide resistance when you're doing exercise. They do need to be prescribed, and they do need to be prescribed by somebody who knows what they're doing, because there are different levels of compression. There are different types of compression garments. Some of them go up to the knee, some of them go up to the thigh, some of them are tights, some of them are cycling shorts. So you do need to see somebody who knows what they're talking about. They usually pull on, but some of them are Velcro and lay flat and wrap around as wraps. And we often use those in people who have problems pulling things on. So maybe they've got dodgy thumbs or they've got bad backs. They don't need to be beige, contrary to popular opinion. They do them in lots of different colours. The flesh-coloured ones, I've never met anyone with flesh that colour. But they're the ones that people think of, the kind of Nora Batty beige ones. They don't have to be like that. They're supposed to be tight, feel supportive, but be comfortable. And they need to be worn from when you get up in the morning till when you go to bed at night. Okay. There are also some garments that people choose to wear overnight. And there are some people who choose to use bandages to increase their compression. But these are all things, if it happens, that you discuss with your lymphedema therapist. There are gadgets to help put them on and off, and they are also available on prescription. They're called donning and doffing aids, but I call them things to help you pull them on and off. And the reason is because, my goodness, they can be tough to get on and off. Okay. Your skin, we've already spoken about this. We don't want bugs getting in, so take really special care of it. In terms of moisturization, we're often asked, what should I use to moisturize if I'm at risk, or what should I use to moisturize if I've got lymphedema? Anything you like is basically what it boils down to, but the things to avoid are anything that's heavily perfumed. The reason for that is not actually the perfume, but the companies put preservatives in the products so that the perfumes don't go off. And it's the preservatives that are normally alcohol based, and alcohol can actually dry out your skin. So some of the heavily perfumed products might cause a reaction, an allergic reaction, but they can also end up drying the skin, which is very strange. So anything, you can go and get Avena or products like that from the chemist, or soap substitutes, but you could just as easily use Avon So Simple, or if you want to go really natural, coconut oil can be very, very good. You just need to be careful if you're using anything oil-based, because it does make your skin a bit slippery. But the plus side is you smell like a Malibu, so that's really, really nice. Keep regular checks for wounds, bites, fungal infections, and treat them if they come along. And be alert to signs of infection. So signs of infection tends to be localized heat, redness, discomfort, and if it gets a bit further, you might feel like you've got a fever or have a bit of flu-like symptoms. Take particular care of your nails and cuticles. If you've got lymphedema, or you're at risk of lymphedema, and you choose to wear false nails or acrylics or dips, please make sure that you are going somewhere that's really, really clean, because some of the parlors just crop up and they're not the most cleanest environments. Obviously, the ideal is that you don't have those on, because you can't see the condition of your nails underneath. But if that's something that you need to do for your mental well-being, the same with tattoos. Obviously, tattoos break the skin. That's what they do. So the gold standard is avoid it in the areas where you're at risk. But certainly in the breast cancer community, a lot of people find having cosmetic tattoos on the mastectomy site very uplifting, and it can help their mental well-being, and that's perfectly valid. Mental health is just as important as physical health. So if you are going to have a tattoo in an area that's at risk of lymphedema, then same as if you go to have a blood test, make sure you're going somewhere that has a very good reputation, that's impeccably clean. Make sure you make them aware, make sure that they're covering the area afterwards. Movement, any movement will help. Build up new activity slowly. If you already have lymphedema, wear your compression. You don't need to wear them if you swim, but apart from that, wear your compression if you exercise. It says there, do not rely on exercise that doesn't involve movement. Okay, so if you're doing yoga and you're spending a lot of time in poses, your lymphatics will stop. The pumps will stop if you stop moving. So whilst you can do yoga, you do need to also include a lot of movement. And even chair-based movements can help. So when you're standing watching the kettle boil, if you go up on your toes, tip your toes and go back on your heels, it will help. Weight management, it's a miserable one, this one, because all the research points to you need to lose weight, which is a bit miserable. But there's no special diet, just one that works for you. Some people with lymphedema say that the low carb diet, similar to what you use for diabetes care, seems to work best for them. Others just do Slimming World, or just cut down or do a Mediterranean diet. Some clinics are unable to see people with a very high BMI. Okay. Some people think that that's discriminatory or cruel, but oftentimes it's just realistic. If your weight is out of control, it will be really, really challenging to get your lymphedema in control. So you do need to be working with your therapist to be having a plan to lose some weight. Don't you starve yourself, be sensible, get help and advice if you need it. Lymphatic massage, there's no research. This is a challenge. Everybody who has ever tried manual lymphatic drainage, which is a form of massage that is carried out by a specialist in that field of massage. It's a very gentle massage. In China, it's called butterfly massage. It's really, really gentle, and it just stimulates those superficial lymphatics and then does some deeper work where the nodes are. It's a very enjoyable experience, and if you're actually undergoing an intensive course of bandaging, it can be really helpful and does seem to work. There's no evidence to suggest that MLD works on an ongoing basis in terms of making your swelling better. That's why the NHS don't fund it, okay? But you'll notice there I said evidence that it makes your swelling better, which is what the NHS measures. There's quite a lot of circumstantial evidence that it makes other aspects of lymphedema better. So it can keep the fluids keep the tissues much softer. There's a relaxation element to it, which can be helpful with chronic conditions. There's also some people really end up hating their limb, and it can be very therapeutic to have somebody else treat that limb with love and respect. So we would never say don't do MLD, but what we would say is shouldn't be an expectation that the NHS will provide it for you. Some hospice clinics do, as they offer other sort of holistic therapies. But there are lots of private practitioners who will gladly do MLD for you. There is a MLD website here, MLD UK, and we would advise that you find a therapist via that website, because you can be sure that they have the appropriate qualifications and the appropriate insurances, and they're up to date. Please avoid cosmetic lymph massage. I could do a half-day course and then call myself a lymph massager. And it's very much what people have done if they want their eye bags not to look so baggy, that kind of thing. It's a very different thing. But you can also learn to do it yourself. We've on our YouTube channel, we've got some very good videos on it. The ILF have got some very good sorry, I'm just reading a question. Some very good things as well. I know we're going to answer the question at the end, but I think this is an important one to say, that some therapists will say if you have active cancer, or if you're undergoing active cancer treatment, that they won't do MLD for you. It very much used to be the thinking that as some cancer cells are in your lymph nodes, if your cancer has tried to spread, if you therefore stimulate those lymph nodes by doing lymphatic massage, that it might spread those cancer cells around the body. There's absolutely no research to support that, but it's very much choice. So some practitioners will say don't do it if you're still undergoing cancer treatment. Some people will say, yeah, that's fine. So it's very much a personal choice, really, but that's the thinking behind it. No evidence to support it, but there's no evidence to not support it either, if you see what I mean. But certainly if you're in the unfortunate position where your cancer has already spread and you're in end of life care, then there's no reason why you shouldn't have it done for a comfort in that situation. And it's only while you're having active treatment that people would say. The things that we do, which I won't spend too much time on, liposuction. Again, this is not what you pay for and go to Harley Street for. It's very much a specialist form of liposuction for lymphedema. Lymph node transplants, lymphatic venous microsurgery, compression pumps, kinesiotape, medication possibly is on the way. So there's lots of things that are going on. Lots of links here where you can find support either from people who live with lymphedema or people who know a lot about lymphedema. There's some really useful videos produced by our colleagues in Wales about all aspects of lymphedema, as well as Cancer Research UK. I've got some really good ones as well. And that's us. We do have a helpline, and we do answer emails, we answer direct messages. We're happy to have a chat. There's lots of information on our website, including ones about reducing the risk and including information about what to do if you're worried about it. So I'm going to stop there and hand over or hand back to the team, and I'm sure that Eszter will be very happy to answer any of your questions.
Thank you very much, Karen, for that very interesting and informative presentation. One thing I wanted to mention is that when you were talking about the compression garments, Karen, and you were talking about how they come in a variety of different colours, somebody has commented to say, I have bright tie-dyed ones. So
yes, they are brilliant. Companies are really improve their ranges, what's on offer, and some of them the range of colors every season, or no, every year, I think once a year. So we are able to follow it, because sometimes I want to choose a color that was last year's palette, and now we have a new one. So they really try to do their best to make it, just a part of like fashionable clothing, and really nice bright colors. Yeah, that's good to hear.
Yeah, I think again, Catherine, it's some people choose to try and hide that they have lymphedema. So some people will be wearing long dresses or trousers and want to go for the very muted colours. And that's perfectly valid and perfectly right for them. But other people actually kind of wear their lymphedema as a bit of a I've survived cancer, and they're almost not proud of it, but they're almost like, I'm not going to hide this. I'm just going to do what I want. And as your commenter said, lovely tie-dyed tights and things like that. So, it's really very much down to the individual. But what people sometimes think is that the brighter coloured ones are not available on prescription, and they are. Talk to your therapist. So don't assume that just because you're getting them on the NHS, you have to go for the Nora Batty beige.
Thank you very much, and thank you for sharing your comment. So we've got a couple of questions in the Q&A box. I'll read out the first one. Hi, are there any skin oils or ointments that could minimise? And they've put a link as an example. Just wondering if we're able to answer it.
Skin oils or ointments that could minimize the edema, or I'm not sure that I understand it fully.
No, they have,
Swelling.
so they've said edema. They've said edema, so minimise the edema. Thank you for clarifying.
No, not as such. No, we are not applying the skin oil purpose. It is to maintain skin integrity and keep the skin hydrated, so the risk of the skin breaking is reduced. Because if we have dry skin, then it can crack, and if it breaks and cracks, then bacteria can enter into the tissues, and that's what Karen was talking about, the risk of cellulitis. We really try to minimize that. So that is the thinking behind using lymphatic fluid.
Oh, we just lost you there, Eszter, for a moment. I don't know if that was just me.
So where, up to which point did you hear me? So what I said is basically we use the skin products to maintain skin integrity, help to maintain skin integrity and a good skin condition, rather than enhancing lymphatic flow. However, the movement of the application is something that can help it, because any little movement of the skin can interrupt the lymph flow.
Thank you, Eszter. Thanks for repeating that.
Can I just add to that? We're supposed to give, nowadays, we're supposed to give a health warning against any moisturizers that contain petroleum, in as much as that they, like things like Vaseline and things like that. We're supposed to remind people that they actually can set on fire. So if you're a smoker, then make sure you don't drop your ash on your legs or sit in front of an open fire. So very few of them do now. They're pulling them back because of that very reason. And the other thing that Eszter said that was really, really important there is that is the way you rub it in. So, you know, think logically, you want that fluid to go from your toes upwards. So rub your skin in, rub your moisturizer in upwards rather than downwards, but then always make sure that you put your hairs back afterwards. So all of our hairs on our legs or in our pubic area tends to grow in a different direction from everybody else's. So you know which way your hairs grow. Make the last stroke of your rubbing your moisturizer in to put the hairs back where they belong, because you don't want any little infections sneaking in into the hair follicles.
Thank you very much.
That's right. Also, can I just add something regarding the ointments? One thing comes to mind, scars. It's really important to moisturize and gently massage, keep them nice and flexible.
We've got very bad sound quality from you. So even if you've got Wi-Fi or reception, you're dropping in and out. We're only catching sort of the first part of every sentence. I think just to summarize, that was probably that scars, and it is important to keep moisturizing. Is that right? Okay, that's fab. Catherine, do we have any more questions?
We do, yes. We've just got a couple more. Yeah, sorry about that. The next question is, I've got lymphedema on my tummy, groin, and bottom. I've been waiting for reconstruction surgery of my abdomen, but I'm afraid because of the lymphedema, it might be more complicated for the recovery. What's your opinion?
I would say that lots of people who have lymphedema have to also have surgery for very many different reasons. So things like hip replacements or, appendectomies or womb surgery. So lots of people with lymphedema have already been through what you've been through and have recovered well. But there are some certain things which we would advise. The first thing is to work with your lymphedema therapist to get your lymphedema to the place it can be before you have the surgery. So that might mean them helping you with some massage. It might mean increasing your compression a little bit to try and get that fluid away from the area before they operate. The second thing is to ensure that your surgical team absolutely know that you have lymphedema in that area and what your normals are. And the third thing is to be aware that because of this risk of infection, the antibiotics you take post-surgery might be different from somebody who has not got lymphedema. So there's a document called the Management of Cellulitis in Lymphedema Guidance. It's available on our website. It's available on the British Lymphology Society website. Print that off and take it with you to your planning appointment for your surgery. It will tell the surgical team and the anaesthetic teams what antibiotics you should be on before you have your treatment and after your surgery. The other thing to consider is if you normally wear compression, you probably won't be able to get that compression on immediately post-surgery because you'll be sore, you'll be uncomfortable. So again, that's something else to talk with your lymphedema therapist about, is what you should be wearing after surgery. If it's lower limbs, for instance, quite often they'll switch you to wraps for a little while so you don't have to bend and pull those garments on when you've got stitches. If it's abdominal and you normally wear very tight abdominal compression, they might suggest you change to just some supportive pants like some Spanx or something like that in the short term. But it is very, very individual, so you do need to work with your lymphedema team, get them to talk to your surgical team if possible, but do be encouraged that a lot of people with lymphedema do have very successful surgical procedures.
Thank you very much for sharing that, Karen. Thank you. And we have another question. Is there anything other than massage that I can use to move my legs? I have a neurological problem and I can't move my legs much, so restricted what exercises I can do.
Again, the important word I would change there is I'd substitute movement for exercise. Okay, lymphedema, you don't have to be in the gym. What you're doing is encouraging movement. So actually, in terms of lymphedema movement, slow and steady is a better effect than frenetic and hard. So there are some simple things you can do. If you're able to walk, then get up and have a walk. Do it very frequently. If you're not able to walk, but you are able to move your ankles, for instance. When you're lying in bed of an evening, just point your toes to the ceiling, point your toes down to the bed. If you're able to lift your knees up, do that. And we're not talking about loads and loads, about 10 times maybe, just to what you're trying to do is to stimulate the muscles. So in a lot of lower limb lymphedema, you're looking at stimulating the muscles in your calves to try and get that lymph fluid, the muscles in your thighs and the muscles in your buttocks to get that everything moving. Another thing that can really help is elevation is good, but you just need to be careful, because often when people elevate, they elevate their feet, and what they're actually producing is a 90-degree angle between their bodies and their legs, which then the lymph fluid has got to get past. So if you cannot have a 90-degree angle when you're lifting your legs, that's good. And we do lovely quite expensive stress balls at the LSM, which raise money for us. So they're really good, but you can just as easily use a soft foam ball, or if you haven't got one of those, use a pair of rolled up socks. Just put them behind your knees and gently, if you can't do it yourself, get somebody to help you to bend your knee and squeeze that sock behind your knee a couple of times. That can help. Or even put it under your foot and when you're sitting down, and roll your foot around. But on our website, and there's some quite good chair-based exercises as well for people with lower limb lymphedema. Lots you can do. Don't think exercise, think movement.
Thank you very much, Karen. And Esther's just in the chat as well that swimming is also an excellent type of activity, if possible, to do. So I just wanted to share that. Thank you very much, Esther. So I think looking at the Q&A box and the chat box, I think that's all of the questions. I just wanted to say thank you so much to Karen and Esther for your time today. It's been such an interesting session, and thank you to all of you for all of your questions and comments. Please do get in touch with the support services team if any questions do come to mind after the presentation today. We have recorded this webinar, so we will be sharing it afterwards if you wanted to refer back to it at any time. But in the meantime, please know that you can get in touch with us if there's anything at all that we can help with. Thank you very much.